Hello and welcome to the internship midterm report. It's me, Sachin Regmi, under the guidance of Dr. Sarmila Chapagai. And here is my report. This is the presentation outline, which is basically divided into Kathmandu rotation, clinical case, and research proposal. Under the Kathmandu rotation, we rotated through AMC, CVL, and vaccine lab, and veterinary hospital and livestock expert center, Lagankhel. Actually, there we learned a lot about infectious and non-infectious pathologies like parvovirus, distemper, CTVT, different type of blood parasite, renal failure, ascites, and all. And among the skills learned, we learned about animal handling, surgical kit preparation, catheter insertion, blood transfusion, amniocentesis, tailored pet vaccine, oral ivermectin preparation and all under the surgical intervention. We learned about fracture reduction, pinning, plating, castration, neutering, CDI, leg amputation, and under the lab work, we learned about microbial culture, AST, gram staining, biochemical test, CBC, GHP, ELISA, PCR, and all. And here is my clinical case on canine trypanosomiasis. The owner name was Siring Lama. He was from Chaville, and the pet was Jumbo, which was predominantly German Shepherd. It was 11-year-old male, neutered, weighing 15 kg, and it was dewormed 2 weeks back. Actually, it was having history of ectoparasite infestation. The reason which it was brought here was because it was recommended since morning and it was howling very painfully. Actually, the animal was feeding normally, but suddenly it was unable to walk with staggering gait and paralysis. We examined it and it was having continuous twitching of eyelid and tremors. The temperature was elevated, pulse rate and respirations too. The animal was anemic, evident by the fact that it had prolonged capillary free time and pale mucous membrane, and the skin turgor examination which rebelled, it had moderate dehydration. Actually, the case was suspected either it was epilepsy, viral infection, or blood parasite. So we went for canine distemper test, which saw it was negative. And the CBC and GHP test, which saw reduced hemoglobin, PCV, and glucose level in blood, but elevated WBC, neutrophil, and blood urea nitrogen. Actually, the blood smear, which was prepared with ginsai staining, revealed the presence of thread-like trypanosoma parasite, and actually the case was confirmed as trypanosomiasis. The provisional treatment before the confirmation was anticonvulsive drug, antipyretic drug, ranitidine, and fluid therapy with normal saline and dextrose bolus 25%. After the trypanosomiasis was confirmed, the diimagine aceturate, that was Berynyl 1 ml, that was 70 mg. It was deep IM, and the same dose was repeated after 7 days. Actually, the case had very good prognosis. Actually, the supported treatment was continued for convulsion, dehydration, and fever. The treatment showed very good clinical improvement. The fever subsided by the next day, and 15-day post treatment, the blood smear was negative for trypanosoma. After a week of hospitalization and veterinary care, Jumbo was happy to return home recovered. And this is my research proposal, which is based on field trial to evaluate serological response following well adjuvant FMD vaccination in buffalo. The progress here is we had selected the animal, vaccinated the animal, collected the blood at 0, 7, and 14 days, but due to the COVID lockdown, we were unable to collect it at 21 day and 90 days, and we were unable to evaluate antibody titer. Thank you.